I'm very happy to be here, and I'm very thankful to Dr. Robert, the Kaqun team, ELO team, for inviting us all the way from Malaysia to come here to this prestigious event. I'm here to share with you a little bit about our Malaysian experience. As Dr. Said has mentioned, it's only arrived into Malaysia early part of this year. So, but in our part of the world, as with medical professions, it's very difficult to accept something new and without, it's just on anecdote. So we have difficulty to convince the public as well. So this is my thought and my thinking on how we can give some proof to these patients, so that and also our colleagues in the medical profession, so that we are not being attacked or being persecuted. So I have prepared some slides. This is a little bit about me. I graduated in '99. This was taken 10 years ago, so I hope I still look good like that by taking a lot of ELO Kaqun and ELO gel. So I also began in pediatrics, and there I was working in the neonatology and oncology section. So I was looking at a lot of death, a lot of mortality, and I decided this life was too stressful for me. I decided to leave, and I wanted to soul searching, and I looked at what was available back then. That was in 2006, and I came across functional and integrative medicine. So that's how, that's what I do now. 100% I go into integrative and functional medicine. And in Malaysia, this is my clinic. Integrative is kind of new, so we will incorporate the doctor, of course. We incorporate allied health sciences. We have life coaches, hypnotherapists, personal trainers, nutritionists, physiotherapists, so as to give a balanced and holistic approach to medicine. So treat the patient as a whole, not just the disease. Individualize the treatments according to the patient's needs. It's important to know what sort of patient has the disease than what the disease that the patient has. Just what like Dr. James said just now, right? So the good physician must treat the disease, and the great physician treats the patient who has the disease. Same. So in Malaysia as well, we are also very mindful and spiritual, so we incorporate that as well into our whole well-being and the treatment as a whole. So diet and exercise, and that's why I was, in a sense, it's good that I'm at the end, because I can kind of integrate everything that was spoken earlier by all the other doctors. They were all speaking about the same thing, how nutrition, lifestyle, diet, all can improve and influence our genetics, and these are called the studies of epigenetics, so that we can gain health, right? Even Professor Lingam was mentioning about intolerances and sensitivities and allergies. So this is also very important in what we do. We also do a lot of detoxification work. We supplement the patient. We, of course, ELO or Kaqun bath is another form of alternative therapy. It gives you oxygenation, and it's one of the most important steps of health, to give tissue oxygenation. So guess what? I have to send my patients to Singapore, so that why are you all so lucky? You have it in Hungary, you have it in Singapore, you have it in the US, but we don't have it in Malaysia. We want it soon, hopefully. So we send them to Kaqun bath in Singapore, ELO bath in Singapore. And of course, we also incorporate relaxation techniques, meditation techniques, and integrative techniques. So some of the nutraceuticals that we do in our clinic, we are also able to give some IV nutrition to the patients to improve their well-being, because most of these patients come, they are nutritionally deficient, and they are fatigued, and they are so on and so forth, right? So many different types of integrated supplementation and things that we do. So, but I guess more and more right now, what we're seeing is a rise in cancer. Usually the patients come, they come with chronic diseases. So they come with diabetes, obesity, and all that can be relatable to their lifestyle related diseases. But eventually all this accumulate, and there comes a point when we're starting to see a lot more cancer patients. Cancer is the second leading cause of death globally now in 2015, and it's predicted to go even higher. Globally, 1 in 6 deaths is due to cancer. And most of these cancers can be attributed to or relatable to dietary lifestyle modification. If you can actually improve those, you can reduce the death of this, the mortality rate. And the economic impact is really very high as well. It's predicted that 1 in 2 men and 1 in 3 women will be diagnosed with some sort of kind of cancer during their lifetime. So how can we prevent it? Is it preventable? And what are the measures that we need to take? So environmental and lifestyle, like what I mentioned just now, weight loss, avoiding tobacco, physical activity, reducing alcohol intake, exercise, meditation, all this helps to improve the cancer risk, reduce the cancer risk. And what else can we do? We can also go for regular screening, blood tests, so we can look at if there's low hemoglobin or high cancer markers, high inflammation markers, like Dr. D was saying, inflammation can lead to things like cancer. Infections also have been linked to cancer, some viruses, for example. But there is still some limitation with even these investigations. There are times when cancer markers are low, but then you discover that you do have cancer. There are times when cancer markers are high, but you don't have cancer. So there are limitations. We can then proceed further to do more diagnostic procedures like ultrasound, CT scan, MRI, but even then, even those diagnostic and imaging procedures can sometimes miss if the tumors are small. Below a certain size of tumor, MRI and CT scan cannot pick it up. And I've had experience with this. I've sent patients to CT scan and they could not pick up the tumor. Then we went on to PET scan and we discovered something. So yeah. And biopsies, what about biopsies? We can do a tissue biopsy, but not necessarily you will pick up a cancer cell. Some of the tissue within the tumor could be normal cells, because a tumor is composed of various types of cells and in various stages of life. Just like us, in this subset of a room, we can see some are aged, some are younger. So, and in a normal cohort, for example. So in a tumor cell, there are some cells which are asleep, some cells which are just awakened, some cells are already active and running, and so on and so forth. So this is important. I'm going to talk to you about it a little bit later. And then there are also a few subclones of cells within that tumor mass which are able to be more aggressive, and they're able to metastasize, right? So is there a way that we can discover the cells instead of just finding the tumor? Let's find out if there's an investigation that we can use to discover if we can detect the cells before the tumor arises. Because early detection equals time. We have the luxury of time. Before the stage of active physical tumor, before there is a tumor burden or a bulk, let's find out if we can discover it while it's still within liquid biopsy, we call this. So, because allopathic doctors, what we call the normal conventional doctors, they don't treat you until they see that there is actual physical evidence of a tumor. Then they will start giving you radio or chemo, and those treatments are really more harmful to you in the long run before it becomes beneficial. So try to detect it early. So if you do detect it early, you then have the option to go for complementary therapy or alternative therapy, much like what we are proposing, right, as like Kaqun and ELO. So a little bit of background of a tumor cell. How does it begin in the first place? Like there's a scientist, his name is Vogelstein. He developed a model of how a colon cancer progresses throughout 5 to 15 years. The environment plays a very key role because the viruses, chemical pollution, radiation can cause a bit of genetic instability, allowing a loss of control, so there's no self-regulation, and the cells can't obey a programmed cell death. So they grow out of order and they grow uncontrollably. That's the definition of a cancer cell. And at the last stage, the cancer cells develop ability to invade and metastasize to a distant organ and cross the epithelial mesenchymal barrier. And then they are also able to sustain themselves in the bloodstream. So I have a case study of a lady. She's a 48-year-old lady with no prior medical history. She's married and she's a housewife of 5 children. But she has a strong family history of gynecological cancer. Her mother died of breast cancer. Her sister died of breast cancer. Her maternal died of uterine cancer. Her cousin also has uterine cancer. Her family comes for wellness and integrative consultation. But her blood works has always been unremarkable, except for a slightly high CA 19.9. Okay, that's a tumor marker, mostly related to bowel. And it's just been above the borderline for a few years. Mammogram, ultrasound, CT scan, even PET scan did not pick up anything. Everything is negative. So this is what I decided to do for her, a circulating tumor cell count. Remember I was telling you about a liquid biopsy? This is it. We take a blood sample and we see if there's actual tumor cells circulating in your system, in your circulatory system. This is just to show you, her cancer marker is only 32 and the threshold is 32. And it's been like that for the past number of years. And that was 1 year, it went up to 44, but then it went back down to 32. So then I did that CTC that I was telling you about, and we discovered there are some circulating tumor cells in the system. But now we have another dilemma. When do we treat them? How do we treat them? Because is there a threshold? There's no studies to say, oh, above a certain threshold, you should now then start treating, give some aggressive therapy or something like that. There's none. So we are now working more or less trial and error or blindly. But I did 2 investigations on her, once in 2016, one in 2017, just to see if there is an increase. But all the while, yes, maintaining nutrition, improving lifestyle, giving her some supplements, etc., right? So, but I don't know when do we start to call it, okay, now we have to go aggressive, now we have to do more. So then came out a new test that we've just discovered. It's called RGCC. In other words, it's called the Greek test. This test can discover the actual behavior of the cancer cells. It will transcribe the genetics, the genomics, and the transcription proteins of these cancer cells. It's an even more sophisticated test than the previous test, which was called CTC. It will basically, have a look at this chart. It will identify the cancer stem cell pool. So cancer stem cell, they are the mother and the king and the queen of the cancer cells. They contain all the genetic material of these cancers, and they can recruit and become a new kingdom. They're like the king and queen. They can be asleep and escape detection and evade chemotherapy, and then in another instance, when the chemotherapy is done, they can re-emerge, re-recruit, and start a new kingdom all over again, and recruit their generals and footmen and soldiers, and become even more aggressive than before, and resistant as well to the chemo drugs that you had been given before. So it's not enough to just attack the physical part of the cancers, because the cancer stem cell mass is still present within the system, within your circulatory system. It's important to make the cancer stem cell pool smaller by attacking the cancer stem cells. And there's a way we can do this. So this is the definition of this research genetic cancer center, RGCC. Detected in its liquid state. It's personalized and specific, picks up the actual viable tumor cells and segregate it according to its immunophenotypes, which are the actual addresses on the cancer stem cells. So we find out what their nature is, right? And they are quantified in the blood. They're given an actual quantity, so you're very objective about it. And you can do chemosensitivity and to natural substances as well, meaning you can culture the cancer cells individually to individual chemo. So you can actually see which ones are the most effective against these cells. And not just chemo, but we can also use natural substances. So I did the test on her, and I discovered in total she has 2.6 cancer cells per ml of blood, cancer stem cells, and they are of an aggressive nature. You see, this is the immunophenotypes that I was telling you about. They are the genetic markers on the surface of the cancer stem cells. So if they are negative, it's great, but if they are positive, that's not so good. And diminished positive is DM positive. It's a lesser positivity than the full positive. But what she has is CD1T3 positive, CD, NANOC positive, OCT4, DIM positive. These are cancer stem cell markers. So they're not good. So what should we do? We can talk to them. We can actually try to put them to sleep and turn them back to negative. How do we do that? We can, what we do is we do the sensitivity to the natural substances. I want to figure a way how to attack these cancer stem cells, talk to them, and try to put them to sleep. And again, like Dr. Was mentioning, he was mentioning something about immune cells and natural killer cells. So we also can recruit this, Dr. Attila, right? No, Dr. So yes, just Ivan. So this is an example of her result. So we can see that Agaricus blazemurae, that is a form of mushroom, artisin, artisonate. This is from Chinese wormwood, ascorbic acid, vitamin C, vitamin D, DCA, lycopene. These are some of the supplements and nutrition, including alpha-lipoic, boswellia, fucoidan, mistletoe, angiosperm. These are all classes of immunostimulants and cytotoxic natural substances. So what did I do? I combine all this. I asked the patient go for Ilosok 2 times a day, whatever she can, because she's busy, she's traveling, she doesn't want to disrupt her lifestyle. They are, they are always traveling the world globally. So I asked her to do whatever Dr. D was implementing as well, the microcurrent, the pulse electrical field therapy, and then started her on vitamin C, alpha-lipoic acid, intravenously, intravenous laser, supplements, and lots of psychosocial advice, support, knowledge. All this empower the patient, gives them a sense of independence, sense of empowerment, and this helps. And of course, she drinks Elo and Kaqun. She's been drinking it for the past 3-4 months. And then the patient is very happy, motivated, she's positive, she's energetic, she's now looking at life at a different angle. She doesn't, become so stressed over things. And then I did a follow-up, I did a blood test, and it is improved. From 2.6 cells, it has now reduced to 2.1. And from all this positive, one has turned completely negative. NANOC has turned to DIM positive. CD133 has turned to completely negative. So there is evidence to show that you can actually turn this off. And if you go on, and she's just been doing this for 2-3 months, if you go on, you can see more and more results. So there was another case, which I just want to highlight to you that you can actually turn down to 0. This patient, he's a 65-year-old male with a prostate hypertrophy and normal pre-SA, normal blood test. Nobody picked up until I was doing this RGCC, and I found out that he had 4.2 cells, and they were very aggressive. So he wanted to try some herbal treatments. So he went off to Australia, did a lot of herbal treatments. And then when he came back and did a test from October to January, most of that has turned negative, and the cells have turned to 0, from 4.2 to 0. Now he's happy. So he relaxed a bit, and then he didn't do all the herbal treatments as aggressively as he should. So then in 8 months after that, it went back up, and a lot of this turned positive. So this tells you just on your own, like a unilateral kind of study on himself, that if you don't keep up a good nutritional lifestyle and modification and diet and exercise and whatnot and all this nutrition, you can increase back the risk of you developing the cancer. So you can change your genetic profiling. You can change with this epigenetics, what we call. So this is a room for discussion. It gives us a role for, there's a role for early detection. There's a role for early intervention. We should all be oxygenated, number one, for sure. So we should all be, that's number one. Nutritionally, we should be sound. Mentally, we should be relaxed. We should adopt all this good lifestyle, right? Those are just ideas on going forwards. If early detection can be adopted as mainstream, then it's easier for us to simply tell the patients, okay, do the Kaqun bath, a ILO bath, take all this nutrition and supplementation, because there is evidence. And what is needed is a lot more doctors around the world to collate and start collecting all this information and bring it in together and centralize it and analyze it. Thank you.
Excellent. Very good. See, very good. Very good. Thank you very much. So, here you are, another patient experience shared. That is how medicine works. It's always good to share experience, and that's what we've been doing all day.